Joy Ballot Box is at 5 p.m. tonight on this channel. Now let's turn our attention away from the elections, and health experts are asking school authorities at the second cycle level to complement government efforts as maintaining protocols on campus as the Ghana Education Service curbs COVID-19 cases being recorded in some schools. They spoke on the AM show.
It's worrying times, I have to admit, because the confirmed cases are increasing on a daily basis. I've listened to a few people, government people, and they talk about the fact that I think the last time you had an interview with the Deputy Minister of Health, he talks about the fact that because we have ramped up testing in the country, that is the reason why we are seeing a lot of cases, which is fine. I mean, that tells you that testing is really not an artifact, of the COVID-19. COVID-19 is not an artifact of the testing. But again, in recent times, I heard one of the seasoned epidemiologists in the country, Fred Binker, talk about the fact that if we really don't step up our game, we're going to hit 50,000 cases not too soon. So it is worrying times. The key question is that, are the mitigation measures not working? Well, it's something we interrogate. Let me first begin by providing some context for the rising cases in school. And I'm sure it's something that resonates with everybody who has been to a secondary school. You know what? In secondary schools, there's overcrowding. The dormitories are overcrowded, assembly halls are overcrowded, classrooms are overcrowded. And to add to that, there's poor ventilation. These are conditions that enable the virus to thrive. We talk about the nutritional status of school children. It's very poor. You go to the dining halls. What foods are they feeding them? These foods are not nutritious. And the last time I was on your show, I mentioned the fact that the president has always been admonishing us to have proper nutrition. And if you're in a secondary school, are you going to have an enhanced nutrition? I'm sorry. It's not going to happen. Ignorance is also a key role in secondary schools and other educational institutions. When students have money as a result of their parents providing them with some little money to feed themselves, what do they spend the money on? On junks, sweets, energy-dense foods that are non-nutritious, poor hand-washing practices in schools because they don't have the infrastructure. How many schools have Veronica buckets? In my department here, we had to buy a Veronica bucket and put it here. But under normal circumstances, government will provide us with some Veronica bucket so that we can distribute them all around the university so that hand-washing facilities can be easily done. That's not to say the university is not doing. They are doing a lot by putting sanitizers and all those things around the places. So my university is doing well in that front, Then again, in schools, management hardly pays attention to our health concerns. They don't. It's not something that is at the top of the agenda. Sorry to say that. Do they have vehicles that when we have severe cases, they can transport them easily? Do they have infirmaries? You go to these infirmaries, they don't even have the medical supplies, So this is the context, So not until we start to address some of these structural challenges, I'm afraid the cases might go up.
Very difficult situation for our students here in Ghana and their parents. Of course, the anxiety and the stress surrounding this COVID-19 crisis is affecting students, their ability to focus, stay on task, and perform to the maximum ability. So my role would be to assist students and their family and their parents to cope, to find ways, practical ways to cope with the crisis. We cannot change the environment, but there are ways to learn to relax, to see things in a relative way and to be able to focus on our tasks. So what we do here at EAP, I'm with EAP Africa, what we do is train parents to assist their children during this difficult time. So the key things, and we're talking about high school students, right, teenagers. I think what is key is to listen and for teachers, staff, everybody around these students to listen to the anxiety. Let them express what worries them. That makes a very big difference for us, for adults, to listen to these children and be honest with our assessment of the situation. They will have questions, they will have worries, and us as adults, our role is to be honest. We don't have all the answers. But I believe that just being present and acknowledging their anxiety, their stress, their worries makes a big difference. And that's the starting point, to acknowledge that there is discomfort, anxiety, and stress. So I think that's the first start. Well, of course, the cultural, landline of Ghana affects the way we behave. But my role is to help those children those young people focus on what they can control. I agree with Dr. Kofi, there are a lot of challenges.
Service has ruled out mass testing of students for COVID-19 despite confirmed cases in some schools. Ashanti Regional Health Director Dr. Emmanuel Tinkrang admits mass testing is the best option, but insists it is too expensive for a developing country like Ghana. Ohiming Teria has more.
Cycle schools reopened last month after a 3-month break due to COVID-19. 6 students, as well as a teacher and his spouse, have tested positive for COVID-19 at the Accra Girls Senior High School. In the Ashanti region, 2 schools, including Konongo Wesley High, have also recorded confirmed cases. Students of KNUST SHS went on rampage on Tuesday following the death of a colleague. They blamed authorities for abandoning the final year 6 student to die for fear of COVID-19. There are calls from some individuals and groups to either close down schools or have students tested en masse. Dr. Tinkrang, however, says neither option is the way to go.
Testing somebody is not enough because, you see, your status can change today. So, for instance, if you are tested positive today, in 2 weeks' time, you may recover. If you are tested negative today and you don't adhere by the protocols and the guidelines, you will get the infection. So for me, I believe that, you see, the primary thing is what should always be done by low-income countries. The testing is so expensive. If you decide that we are going to test maybe about 600,000 Ghanaians, at a point in time, you won't even get the logistics, because you have to import the reagents, a whole lot of things. So mass testing, though, is good, it's not encouraged for low-setting areas, low-resource setting countries. What is good for us as a low-resource setting countries is the public health measures.
Dr. Tinkrang maintains winning the coronavirus fight in schools requires students and their teachers to adhere strictly to all preventive protocols.
The students cannot remain in the house throughout. We don't know when we are going to get vaccines. So maybe if a country decides that their children are not going to school, and it takes us 2 years to get vaccine, then by 2 years' time, do you know what's going to happen? So one thing is that it's not a matter of waiting for anything, because the COVID will not go today or tomorrow. What we can use to destroy COVID is to make sure that we embark on the public health measures to control COVID. So we can do whatsoever we like. We can go to school, we can go to work, and the basic principle is doing that in the midst of adherence to the 3 core principles.
The Conference of Heads of our sister second cycle schools, CHAS, says it is not for closure of schools, but it supports calls for mass testing. Ashanti Regional President, Reverend Father Stephen Osu-Sechere, however, indicates it's a decision for Ghana Education Service to make.
We were crying for mass testing even before school reopened. But the experts told us that the mass testing will not do anything. Now that all students are in school, if they decide to test everybody, I think that would be good for us. From where I sit, I don't have the data to be able to determine whether or not schools must be closed down. I don't have that data, all right? But what I know is that when those who have the data, I mean management of GHS, they have the data from every region. So they'll be able to put together that data and say that, okay, because of what is happening, we should close down the schools.
From Kumasi, for JoyNews, Ohiming Teria reporting.